cases are now spread out in various counties in the country. Kitui now has 1 case. Nairobi County has 6 new cases, while Mombasa 1. This now puts Nairobi County at 34 cases of those who have so far tested positive, followed by Kilifi at 6, Mombasa at 3, Kajiado and Kwale 1 each, with now the Kitui 1. Out of the 44 cases, 26 are male, while 18 are female. To date, we have tested 1,005 persons for the coronavirus disease. From the above data, it is evident that the virus is now being spread through community transmission. This now calls for a lot more personal responsibility among Kenyans in this fight against the disease. Community transmission means that the disease is no longer imported from the outside, but is here with us. We are now spreading it among ourselves. We must now raise our level of alert and intervention measures. To this end, we need to take a number of measures, with the most immediate being in the border transport industry. For now, we need to protect our youth who are in this industry as border riders. And therefore, we will now require that any border rider, to protect himself, must carry only 1 passenger so as to maintain some level of distance. Secondly, the border rider and the passenger must wear masks for protection. We shall be spreading out masks in the counties for this purpose, but irrespective, they must wear, the border rider and the passenger must both wear masks. We expect border association leaders to oversee this process and ensure its implementation. The police will obviously be enforcing the same. Having said that, let me repeat that we are doing so to protect both the border riders, and you can imagine how many people a border rider has behind him for per day, and they have no idea who has got the virus and who hasn't. This is a measure so that that business can continue if it continues to follow the rules. Following the imposition of the curfew in our country, we are now urging that you should be able to go to night shifts. If you are on a day shift, you should be able to go on a day shift. But in terms of the difficult times that clearly everybody is going to experience, we have plans as a government to see how we can assist people as much as we can, including the answer to your question regarding foodstuffs. But what we would like to urge is also communities. The business community has already volunteered to do to take over some of the issues that you have said. In fact, even providing food in certain cases. But what we are also asking is let our communities work together for a change. Let people be together. Let's share what one has. I'm also asking the employers, please do not withhold people's salaries, people's wages, just because of the situation that currently exists. And for clarification, The 4 p.m. departure is not to say that you start reducing people's pay or people's salaries. It is simply to allow them to leave a bit earlier. Some of the people that we are dealing with have helped employers for many, many years. It is time also for employers to support them the way that employees have also supported these companies. So it's time to give. This is a time to give. It's a time to sacrifice. And we all should, and we all must. And further, for further clarification, yesterday, when we were talking about the number of cases that we had, one of the people that we announced, we said that was an American, but it has further been clarified that the person had actually traveled to America, but was not an American, and that is regretted.
CS, 2 weeks ago you didn't mention, actually a week ago you didn't mention that the coming 14 days are going to be crucial, especially for the authorities and for Kenyans. In terms of their progress, what are our greatest advantages? Because we are so far 1 week into the 2 weeks, and what are our greatest fears? How are we doing in terms of, even as the numbers are coming in, we are at 50 right now. Where are we in terms of comparison with how this particular pandemic has affected the nations, and especially Europe? So are we scared? Should we be worried right now? Or is it a thumbs up for us as it stands?
I hear you. Let me put it this way. We have tested 172 samples. Out of this number, a total of 84 samples from quarantined guests have been analyzed. We have received confirmation of one person who have tested positive for the coronavirus disease. Apart from those in mandatory quarantine, we have also tested an additional 88 samples of close contacts of the 42 confirmed cases. Out of this number, we have received confirmation of 6 patients who have tested positive for the coronavirus disease. An additional 1 patient from the Aga Khan Hospital. This now brings the total number of confirmed cases in the last 24 hours to 8. The total number of confirmed cases now stands at 50 in the country. For the 50 confirmed cases is ongoing. The total number of close contacts that we have so far been monitoring stands at 1,474. Out of this number, 231 have been discharged after completing the mandatory 14-day follow-up period. Currently, our teams are monitoring 1,211 close contacts. Because I think it's almost a month since we announced, it's going on to a month, since we announced the first case. Now, when you look at other countries, the examples from other countries, it's very different. Some countries are very different from what we have experienced. But so it evolves, we will